Thank you. Again, thank you everyone for joining us. It is 10:59. We will give it one more minute and then we will get started. Okay, just a reminder before we get started, if you need access to record or like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today. We are limited to 1 hour. If there are remaining questions in the queue when we conclude at noon and you feel your question hasn't already been answered, please send them in the chat or by email. We will work to get you a response in writing. Thank you. It is now 11 a.m. Dr. Vanderhoff, we can go ahead and get started.
Thank you very much. Good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Thanks again for joining me today. Well, it appears the Delta surge has in fact plateaued. Nevertheless, we continue to see very high numbers of COVID-19 cases and hospitalizations. Yesterday, for example, the 24-hour difference in cases reported was more than 4,400. If we compare that to 1 year ago on the same day, that number was a little bit north of 1,400. In addition, we saw 323 new hospitalizations reported yesterday, while 1 year ago, we saw 123. We are higher than we were a year ago, but I remain cautiously optimistic that we'll continue to see our cases decline as we move forward. I want to remind everyone about the timing of these numbers as we follow COVID-19 cases. The first data that we see is that a COVID-19 case is reported following a positive COVID-19 test. After that, within days or weeks, someone could become seriously ill and end up hospitalized and hence end up in those numbers for hospitalizations. And sadly, after a hospital stay or a weeks-long battle with the virus, a person could then pass away. Now remember, even then it can take weeks or even months to get verified data regarding deaths. So our mortality information lags even further behind case data. This all means that we may not know the full impact of this surge numerically for some time. But what we do know is that our hospitals are continuing to tell us that they are feeling the very real effects of the surge right now as they continue to face capacity challenges in their ongoing efforts to save as many lives as possible every day. So while it's tempting, it is far too early for us to claim victory. Although cases are declining, the situation in our Ohio hospitals remains very serious. The Ohio Hospital Association, for example, continues to report that 1 in 6 hospitalized Ohioans is COVID-19 positive, and 1 in 4 in the ICU is battling COVID. In our rural hospitals, we continue to see those numbers are even more stark, with 1/3 of hospitalized patients having COVID-19 and about half of all the patients in the ICU being there because they are fighting COVID-19. As this virus continues to mutate, the best thing that all of us can do to protect ourselves and to get our population, to get the state ahead of this virus, is to choose to be vaccinated. When more Ohioans are vaccinated, it lessens the opportunity for dangerous variants to take hold and helps us on our path to gaining control of this pandemic. Now, even as COVID-19 continues to spread across Ohio, flu season is also now upon us. As one would expect in mid-October, we are beginning to see some flu activity here in the state. Remember, as bad as it sounds, you actually can get both the flu and COVID-19 at the very same time. Now, the good news is that we have vaccines to help prevent severe illness from both the flu and from COVID. So now is the time to get your flu shot. And if you haven't already, it's also the time to get your COVID-19 shot. And remember, you can get both shots at the same appointment. All in all, the message is now is not the time to let up. We have to remain vigilant. We all have to continue to do our part to stay healthy. And this includes, of course, choosing to be vaccinated, as well as wearing a mask when directed and practicing other preventive measures like good hand hygiene and good cough etiquette. The steps we take today will protect us in the future, particularly as we approach the busy holiday season. Remember, if you're getting 2 doses of a vaccine, it can take up to 6 weeks or more to gain full protection. And Thanksgiving is just 7 weeks away. So if you haven't yet been vaccinated, now really is the time to talk to your doctor about it, get the facts, and then I would hope you choose to be vaccinated. Now, these precautions will not only keep us healthy, but they can also go a long way toward alleviating the pressure that is really being experienced acutely by our health system, especially our hospitals. Today, I'm joined by 2 physicians to share what they're experiencing on the ground in our hospitals. First, I am joined by Dr. Kurt Tucker, the Chief Clinical Officer of the Adena Health System in Chillicothe. Dr. Tucker, we've heard a lot about hospitals being really pushed toward capacity, both because of the influx of COVID patients and the concomitant challenge of some staff shortages. Could you share with us a little bit about what you're experiencing at your hospital?
Sure. Hopefully you can all hear me well. Adena Health has been experiencing a challenge along with the rest of the state. Certainly in the wintertime, we reached a peak of around 60 inpatients, and the Delta surge dwarfed this by comparison. It brought Adena Health System upwards of 95 total COVID inpatients, which was quite a challenge for us down here in rural Southern Ohio. We've been able to try to navigate this through many efforts at helping to sort of focusing on the sickest of the sick, programs that after completion of inpatient treatment schedules like steroids and remdesivir breathing treatments being established on oxygen, getting people home to finish their convalescence. As you're well aware, Dr. Vanderhoff, it can take people upwards of 3 weeks to make their way eventually off of oxygen. And some unfortunate individuals end up with months of therapy being needed. We've had to divert nursing staff from non-clinical areas of the hospital, such as quality, over back into inpatient duties. We've asked primary care physicians and nurse practitioners to serve on the front lines in urgent care settings because we've seen nearly a doubling of our urgent care volumes in all of our locations. So really reaching in all directions to try to make small incremental improvements in our ability to handle the capacity. And somehow the nursing staff and our physician APP staff was able to pull it off. And we're very thankful that that plateau appears to have been reached.
Well, thank you, Dr. Tucker. You know, you've described some of the extraordinary measures that your hospital, and I know many others, have undertaken to try to deal with the challenge of these very high numbers of patients requiring your hospital services at this time. But I also know that there's a lot of innovation going on in all of our hospitals, including Adena. Can you share with us a little bit of some of the ways that your team has really innovated to ensure that patients are able to get what they need in the face of some of these challenges?
Certainly, we learned a lot going through and volunteering to be one of the state's mass vaccination sites, and how to process large numbers of people needing either a test or a treatment. And we applied that to a drive-through testing facility, which doesn't require a physician's order, that patients can present to with symptoms, be swabbed, and then have results within 15 minutes. Obviously, fundamental to the community in order to know if you've got COVID or not, can you safely return to school or work? Very important component of that. As I mentioned, one of the larger innovations really around COVID surge treatment is how do we decongest the inpatient units of the hospital? As you mentioned, nearly half of our ICU patients are COVID patients. We reached over 40% of our inpatients being COVID patients at one point in time. So our ability to complete those critical treatments and then to get people in a setting, number one, where they're comfortable, number two, safe, but then can finish that convalescent phase with close nursing oversight and attention. We pulled in the population health nursing teams, caregivers to do virtual visits on a daily basis with these patients, collected vitals from their home several times a day to know whether or not their saturations were changing. That would allow us to triage them back if they were home and getting sicker again and needed our services further. So I think that those two things have probably been some of the larger ones. We've also, as you mentioned, the efficacy of the vaccine, begun immunizing people that aren't here with COVID, but are here for other reasons before they're discharged from the hospital. So those are two or three of the ways that I think that we've been pressed to be a little creative in how we practice medicine.
Wondered if you could also maybe give people a sense of just how busy our hospitals really are. You know, we're all thankful hearing numbers that, hey, nationally, it looks like we've crested. Things may be pointing in a more favorable direction. But, you know, I think that somewhat belies the reality that our hospitals are facing of really being still extremely busy. How would you compare the sense of busyness at the hospitals now to other points in the pandemic for the community?
That's a great question. I think the best way to do that is a lot of people hear about rooms or beds. We don't have enough beds. Well, in reality, what health systems are talking about is not just physical beds, but the staff that can dedicate effective amount of time to care for people that are really quite sick. These people are on the verge of respiratory failure, requiring intubation. And to understand that, I think the point that brings it most home is to talk about how many patients each individual nurse is assigned to care for and for how long. So typically health systems talk about nurse to patient ratios of 1 in 4 or 1 in 5. I know that all health systems have had to stretch their resources, sometimes nurse to patient ratios being 1 in 8, which if anybody knows a nurse and how busy they are and how much work is involved in treating the acutely ill, that is really kind of burning the candle at both ends. So imagine yourself as an inpatient for any reason, a heart attack, a stroke, or even COVID, and now your nurse essentially has half the amount of time that he or she otherwise would have to address your many times critical needs.
You know, thanks for that. I know your hospital, among others, signed an open letter to the community asking for residents to help with everything you've just described in mind. What would your message be about the best ways that members of the community really can help the community get through this time?
Certainly. I like to reference back at the very beginning of the pandemic when everybody talked constantly about flattening the curve. How do we flatten the curve and help our healthcare systems and providers more effectively handle these very sick individuals? Is reduce the transmissibility of the infection, reduce the number of people that an infected person then infects. So we already know the ways to do that is obviously social distancing, trying not to go to crowded indoor places without a mask. That's very, very, very risky. Certainly the most important is go out and try to get vaccinated. The most important thing. We know that it doesn't prevent mild COVID. We know many people that have been fully vaccinated and had mild COVID, but we know for a fact that it prevents severe disease and death. Less than 2% of the deaths in the state of Ohio as of this morning on your website indicate that those deaths are in fully vaccinated individuals, which to me as a physician is striking. I hear lots of people talk about their concern about the vaccine and worry about side effects. Just for point of reference, the two major side effects I hear most people quote are anaphylaxis, which is a severe allergic reaction that can be life-threatening, and myocarditis. 3 out of a million patients that are vaccinated are developing anaphylaxis. Approximately 4 out of 100,000 are developing myocarditis, which in most cases is mild and self-limited. 1 in 500 Americans has died of coronavirus. So the ratios right there bring it strongly home that your risk of getting the infection and suffering a dire consequence is infinitely greater than anaphylaxis, myocarditis. Most of the others reactions are very minor compared to those above. So that's what I'd like to convey today.
Thank you very much, Dr. Tucker. Very, very well said. Next, I'm joined by Dr. Adam Mezoff, Chief Medical Officer and a pediatric gastroenterologist at Dayton Children's Hospital. Dr. Mezoff, we've heard that children's hospitals across the state are also sounding the alarm, particularly as we're facing a variety of respiratory illnesses seemingly all at once. COVID-19, RSV, and now, of course, there's the risk of flu in the state. Can you describe what you're seeing in your hospital right now in terms of respiratory illness and COVID-19?
Yes, happy to, Dr. Randolph. Thank you for the opportunity to be here today. Thanks to everyone for being here. We, on a day-to-day basis, have to make a decision on whether or not we can accept patients from outside our hospital or our region. People in my role and the other children's hospital in the state of Ohio are doing the same thing, which means that our beds are literally full on a regular basis. And the challenge, of course, is how do we limit that? And I think Dr. Tucker stated it very well. We have very dedicated caregivers who are burning the candle on both ends trying to keep up with this. And so it's incredibly important for everyone, including the children in our hospitals, that we mitigate or prohibit this infection from spreading any way possible, because even if our hospital isn't 40% full with COVID patients, that extra 10 or 20% is tipping us over the edge with what we're able to do. And I have reminded folks, and will remind again, and would agree with Dr. Tucker, it's staffing. But remember, our staff can get sick, so we lose them for that. Our staff's children can get sick, so we lose them for that. So anything we can do to stop folks from getting ill, especially with serious infections like COVID. And by the way, children do get seriously ill with COVID. To answer your question more specifically to our area, I will tell you that towards the end of the summer, beginning of the fall, we might have 2 or 3 patients in our hospital with COVID. Now we regularly have anywhere between 10 to 15. We didn't used to have many in the ICU on a regular basis. Today, we have 1 in the ICU who's on a breathing machine. Again, kids are getting very sick, maybe not in the numbers as adults, but I don't want people to leave with the idea that kids aren't getting very sick. I would mention one other fact for you. There is a chronic, essentially a long COVID version in kids called MIS-C, which is a multisystem inflammatory disorder. In the last 2 days, we've had 6 patients with this problem admitted, whereas in the last few weeks, we may not have had that kind of total. And what that tells me is, as we get further into this surge of COVID, we're seeing the long-term complications that COVID can bring to children. Thank you.
Dr. Mezoff, I'd like to take that just a step further, because I think you're making a very, very important point that I want to underline. So many people across our state are very understandably saying, look, this has been going on a long time. You know, we've been living with this 18 plus months. Surely our hospitals and our pediatric hospitals have been living with the reality of COVID, that amount of time. It's been bad for a long time, right? What's going on now? Could you provide just a little more perspective on the severity and volume of COVID illness itself that you as pediatricians in a pediatric hospital really are encountering, and how that's different than what we saw before?
Absolutely. Thank you for the question. So I think in a large part, the Delta variant has been a big game changer in the pediatric world. I think early in the pandemic, it was unusual for us to see patients last year, unusual for us to see pediatric patients in the hospital. In fact, we spent a lot of time and energy expanding the age limit of our hospitals to help out our adult colleagues because they were so overwhelmed. Now we would love to help them, but can't, because the volumes of patients we're seeing are just so great that it's all hands on deck for us to be able to manage through what we see. Again, we're literally seeing, if you want to use percentages, 10 times the number of patients with COVID in children that may need to be in the hospital than maybe 6 to 12 months ago. So as this virus mutates, as we see new forms of it, we're seeing that affect different populations in a different way. And it is absolutely contributing to a large overflow of patients in pediatric hospitals, which again worries us because we want to be here for you when you have appendicitis. We want to be here for you when your child has an injury from a sport that they're doing. And it's very hard for us to give you the service we want to give you when we're also inundated with all these other respiratory illnesses. On top of that, an illness like COVID, which can seriously affect children.
Yes. Finally, we know that many more schools over the course of the past weeks have implemented masking policies. I know that in conjunction with public health of Dayton, Montgomery County, your institution, Dayton Children's, compares the data on cases of COVID-19 in schools that have masking requirements with those where it might be optional. Can you share a little bit with us about what you're seeing in terms of that data and what the impact of masking seems to be on the COVID-19 numbers?
Yes, happy to. So what we've been trying to do is partner closely with our school systems in town and with our public health department. And through the information we get through public health, which includes zip code analysis of where these infections occur, and by matching this up to the schools that have mandatory masking and those that have optional masking, what we have found is the following. In the last several weeks, since many schools have been trying to help out by going to mandatory masking mandates, we have found that the incidence of COVID in those schools has decreased by 67%, by 2/3. What we have found is in the schools that are not mandatory masking, the incidence has actually gone up by 30%, which means when you compare the two, that there's almost a 4-fold difference in the incidence of COVID in schools with mandatory masking versus schools that do not have mandatory masking. And the reason in part that the number of cases went up in those schools not masking is it's a true reflection of what the incidence is in the community.
Thank you very much, Dr. Meslow. Well, I know that we have been fighting COVID-19 for a long time. I know it's impacted all of our lives significantly. And I know that this can feel at times like an almost never-ending journey, but I'd ask you to please hang in there. This is not the time for us to let up. More than 63% of those ages 12 and up who are eligible for vaccination have started the vaccination process, and we see this number growing every day. So we're hopeful that we'll hear news also about the authorization of COVID-19 vaccines for the 5 to 11-year-old group coming in the weeks ahead of us. We're getting closer to being able to live life the way we want to. But for now, we need to continue to be cautious and to take the necessary steps to prevent the spread of COVID-19. Now, to continue to encourage Ohioans to be vaccinated, we of course have launched Ohio Vax to School. At this time, Those ages 12 to 25 can enter to win $2 million in available scholarships. We're hopeful that if authorization is granted for the Pfizer vaccine for those ages 5 to 11, that at that moment we'll be able to expand the program to include those younger Ohioans. Those who are eligible, remember, can register themselves or their children today at www.ohiovaxschool.com. The high rate of hospitalizations in both children and adults, as we've shared this morning, really does continue to put a strain on our healthcare system. And hospitalizations from COVID-19 remain primarily, as Dr. Tucker reminded us, among those who are unvaccinated. The best thing that all of us can do is to choose to be vaccinated against COVID-19. And when advised, wear a mask. Finally, continue to practice proper preventative measures. Things like washing our hands or staying home if we're sick. So with that, Megan, I'd like to conclude and open it up for questions.
Thank you. Your first question is from Dan Jarus with WOIO TV.
Good morning, gentlemen. Doctors and Dr. Vanderhoff, if you've had personal contact with patients, feel free to jump in on this. But I was wondering if our doctors could share really that plea that we've been hearing, that when people who decided, well, the vaccine's not for me, I'm not messing with that, and they end up in the ICU. Can you walk us through some personal stories of people who are begging and pleading for the vaccine, even though they're sitting in the ICU and we know that's not going to help, or a personal story of somebody saying, man, I really wish I would have gotten the vaccine?
Yeah, I'll ask maybe Dr. Tucker, you could start with your adult experience, and then Dr. Mesoff, you could follow up with maybe some experience from the pediatric world.
Certainly. I think that's a great question. It's something that most folks don't get to see unless they walk around in our shoes. And it's quite tragic. So I regularly round in the ICU with the team and speak to the nursing staff and the critical care physicians. Two terrible examples. I review all of the COVID-related deaths. And just this morning reviewed our latest individual around 60 years old. Really no major medical issues. Her risk factor was a little extra weight. Just didn't feel that she had the medical problems that qualified for her as necessarily high risk. She was admitted in early October with coronavirus, deteriorated, and is now on this terribly unfortunate list of those that have expired because of this. Not necessarily at our hospital, but another local institution, 21-year-old male, same risk factors, carried some extra weight. You know, most of us at 20 think we're invulnerable. The stories and the conversations I had with that nursing staff on how tragic it was for this individual and their family to look back and think what an easy opportunity we missed with vaccination, how simple it is, yet the opportunity not taken. And you can talk to any hospitalist, critical care physician, and hear story after story of people that are now face front with reality in the hospital on higher and higher degrees of oxygen, and ask the nursing staff, could I get the vaccine now? And it's too late. It won't work at this point in time. And finally, a nurse in the ICU shared with me that a family had come in, an unfortunate individual in their 60s, now in the ICU on the ventilator, husband and wife pair in the ICU, same time. The entire family asked the nursing staff, what's the closest place we can get to be vaccinated? So that is a very real conversation amongst our inpatient care providers with families and the infected.
Dr. Mesa?
Yes, thank you. The experience we have is a little bit different, and the experience we have is borne out by a study recently done that showed over 100,000 children have lost a primary caregiver during the epidemic. So what we will often see is a child who comes to visit us in our outpatient clinic and will find that their mother or father isn't with them in a visit when they usually have been, to discover that they have succumbed to a COVID infection. And now it's, where do we get everybody vaccinated? So the stories that I hear and that we experience more are the loss of a caregiver of a child who will never see their grandmother again or never see their mother again because they didn't get vaccinated and they passed away because of the infection.
Also, Dr. Meslov, could you comment a little bit more about MISC? Because I think it is part of the COVID picture that really is impacting our children.
Happy to. MISC is a condition, just as it's stated, which states multisystem inflammatory syndrome. But what happens is children come into the hospital with various initial complaints and often get very sick. Their blood pressure drops. They end up in our intensive care unit. They often need a lot of medication and other things to survive. Often they have to have their hearts checked for weeks, sometimes months after, because it can affect your heart when that happens. So we consider it a fairly serious condition. Fortunately, it is considered rare. Having said that, we have perhaps almost 50 kids that we've seen in the last year or more who've come down with this condition, and it is often very frightening because of how sick they get.
Your next question is from Pete Grieve with Spectrum News.
Good morning. Dr. Vanderhoff, I was wondering if you could provide an update on test and stay policies for schools in the pilot in Warren County, because we've now seen some schools outside of Warren County implementing such a policy.
Yeah. What I can tell you is that the information that we're getting from the Warren County experience is favorable. And we are actively looking not only at that model, but some test to stay models that have been applied in other states with an eye towards how those models might be useful or applicable here in the state. So we're very, very mindful of the importance, and we've spoken repeatedly about the importance of kids staying in school. And I just want to remind everyone that we currently have a model here in Ohio that provides multiple pathways for kids to avoid the need for even considering quarantine that would take them away from school, including being vaccinated or wearing a mask. And so the models that have been applied nationally and here in Ohio really involve bringing those kids who have had school exposures, allowing them to remain in the school environment with masking. So it really all circles back to masking, sometimes supplemented by testing. It is somewhat ironic to me that the solution really is the solution that we've been pointing to from the beginning, which is either get vaccinated or wear a mask. But more to come. We are actively looking at further ways that we can help our schools with the important goal of keeping kids in school in person.
Your next question is from Danny Eldridge with Hannah News.
Hello, Dr. Vanderhoff. So my question is about the vaccine for 5 to 11-year-olds. How is the state preparing to roll that out? What are you hearing from the federal government about when that might be approved?
Well, first, in terms of scenario planning, we have, as we've done with every milestone in the vaccine journey, we have been working very closely with all of our partners so that we can assure that we are ready to go if and when that group is authorized to receive the vaccine. Of course, the vaccine that what has been submitted by Pfizer for authorization involves a different dose of vaccine. So it's going to be a little bit different in terms of the operational steps that have to be undertaken. But again, we're ready from an operational point of view for launch whenever that green light might be provided. In terms of the process, I think we're getting very, very close. One of the important milestones has in fact been crossed, and that is that the manufacturer has formally submitted the request for review and consideration of their product for administration to this age group. As I look ahead at some of the scheduling that I see for the FDA Advisory Committee and the ACIP, it really looks to me that like they are planning to have those meetings occur by the beginning of November. So that's very, very encouraging. And I would expect that we're probably only a matter of weeks away from a decision, and hopefully that will be a positive decision.
Your next question is from Tom Bosco with WSYX.
Hi, doctor. Can you give us the latest recommendations for Halloween and Thanksgiving? Are they safe? And do you worry that people will hear only the headline of we're plateauing and get a little bit more lax and not take as many precautions?
Yes, thanks for that question. It's certainly very timely. I want to remind everyone, though, right out of the gate that, look, vaccination is still our best tool to prevent transmission, hospitalization, and death from COVID-19. But of course, many of the children who will be interested in trick-or-treating are not yet eligible to receive that vaccine. But we still have tools available to us to keep them safe and to limit the risk of the spread of this virus. Now, the CDC has itself not yet released any specific guidance about the safety of trick-or-treating, but there are a number of health experts that have opined and offered us some recommendations that I think we can look towards. First, it's important always to think about masking and physical distancing. Halloween, by its very nature, offers us some terrific opportunities to incorporate masks, face coverings into our costuming in a creative way. So number one, wear a mask. And the good news is with trick or treat, masking has been part of trick-or-treating for a long time. It's just this time we're asking for a different kind of mask to be incorporated, but you can imagine all kinds of creative ways that could be safely and appropriately done. Secondly, trick-or-treaters should really travel in small groups of people that they're normally with, rather than in those large groups that sometimes we've seen as they go from house to house. Third, let's not forget about the importance of hand hygiene and cough etiquette, especially if we're going to be around others. And if you're sick, as exciting as trick-or-treat might be, it's really the right thing to stay home. You don't want to be passing COVID-19 on when you know that you could just stay away and avoid getting other people ill. And finally, let's think about what that environment at the doorstep or wherever the candy is being distributed looks like. Children should avoid gathering in a big group, tight in at a doorstep. Remember, stay in those smaller groups, keep some distance between those groups, and make the grabbing of the treats kind of a brief encounter so that we're able to assure that there's limited interaction between people. And more information may very well also be available to you at the community level and through your local health department. because they are very interested in looking at their communities and providing good advice about staying safe and healthy.
How about Thanksgiving? Any thoughts on that?
Well, I think the same guidance really is applicable there. Look, when we get 7 weeks from now, we're still going to be dealing with a substantial amount of COVID-19 in the environment. When we look at how the Delta wave has crested and then declined in other parts of the world, and even here in other parts of our country that were more on the front end of the Delta wave, it doesn't just drop off like a cliff. There's typically a fairly long plateau and then a decline over a fairly substantial period after that. So as we approach Thanksgiving, let's remember all the things we know work. First of all, the best thing is for everybody in the group to be vaccinated. A group of vaccinated people gathering together for Thanksgiving is far better off than a group that is unvaccinated. If you're due for a booster, if you're over 65, get that booster well in advance of Thanksgiving. If you haven't been vaccinated yet, this is the week to do it. This gives you ample time to get your 2 doses and build that immunity. But if you're unvaccinated, look, there's a real risk when people gather together in a group indoors. Number of things to think about. If the weather will allow it, have those windows open, maybe still think about something out on the patio. Ventilation really matters with this virus. Think about whether maybe masking would be a good idea, and think about the table. Might there be opportunities to separate people further apart as they are eating, much as we see happen in restaurants? So a lot of the same guidance that we've talked about with Halloween is applicable for other holidays. The challenge, of course, as we move into the winter holidays is that we'll be inside. Best thing, get vaccinated.
Your next question is from Chelsea Sick with WKEF.
This question may be more for Dr. Mezoff. Are the majority of kids in the hospital with COVID-19 school-aged children? And is there a message you would like to send to school leaders and parents here in the Miami Valley who are not requiring masks in schools or masking their children while out in the community?
Dr. Mezoff.
Thank you. The majority of children are school-aged, and sadly, those that are old enough to get vaccinated haven't been. So I'm not saying there aren't children in the Miami Valley that have been vaccinated. To date, we have had no child admitted to our hospital with COVID that has been vaccinated. So I think the message is consistent with what Dr. Vanderhoff has been saying, which is vaccines are an important part of things, especially if we have the age drop that we're anticipating, and that masking can help prevent infections.
Your next question is from Lindsay Mills with 10 TV.
Good morning. On Monday, we saw that Merck filed for emergency use authorization of that first oral treatment for COVID-19, molnupiravir. That combined with the news that we're expecting to hear, hopefully the good news, to give the green light to the vaccine for the 5 to 11 age group for one brand of the vaccine. How will those 2 developments combined shape our future going forward? What will those 2 developments mean?
Well, thank you for that question. I'll tell you, from a public health point of view, those are very, very important milestones in the COVID-19 journey. And I think that they do signal a pivot point for us in how we think about, how we approach COVID-19. So at the Department of Health, we're very mindful of that. And we are actually not only looking at it, but talking to health departments in other parts of the country, as well as to national authorities about how that impacts our population level approaches to COVID-19, including questions around issues like how and where quarantine can or should be modified. So a lot of work going on there. This is very, very good news for all of us. Being able to offer vaccines to everyone school age and older is very important, very good development. And then adding to that, access to a relatively easy to take therapeutic medication that has, at least in its early data, demonstrated some very impressive ability to reduce the risk of developing severe disease from COVID-19. Both really are very good, very favorable developments as we battle this virus. Let me just see if, I don't know if any of my colleagues would have anything to add to that, but I'd like to at least give them a chance. Doctors Tucker and Mezov, anything that you'd add?
Certainly, the molnupiravir would be profound. It will represent the first oral therapy option for those with early mild to moderate COVID. What it does is reduces the progression of the illness to the point at which you're going into respiratory failure, need hospitalization. So this was not a huge study. It was phase 3, I think a couple thousand people. It cut the rate of progression to hospitalization in half in the treatment group. There were 8 deaths in the placebo group, the people that got sugar pills. There were no deaths in the treatment group. So this is would be profound. If it's demonstrated to be safe, it'll bend the course of this condition for the nation and the world.
Nothing to add, sir.
Your next question is from Jim Province with the Blade.
Hi, Dr. Vanderhoff. There have been some experts predicting that there will not be a winter surge given the trends of the Delta variant right now. I mean, there had been predictions originally that that we were probably going into another bad period. Do you share that optimism? And are there fears that we may replace a COVID surge with the flu surge?
So great questions. And as you can imagine, they're questions that I think a lot about and have studied pretty deeply. One thing that I have learned about this virus is that predictions are fraught, and that I have given up attempting to predict what this virus will do. But what I do know is this. It is by its nature a virus that spreads more readily during the winter months. In many ways, we were very blessed to have encountered Delta during the summertime. I genuinely fear that had this hit us in the winter, we would have had a even more severe experience than what we had. But as we look ahead to the winter, I think that if nothing else, Delta has really taught us some very important lessons about coping with winter respiratory viruses. So whether it is respiratory syncytial virus, RSV, that year after year has in fact typically significantly impacted our pediatric population, or it's influenza that in most years affects a lot of Ohioans of every age, or it's COVID layered on top of that. I don't think we can let our guard down. So as we are heading into the winter months, let's use good common sense. First, let's protect ourselves where protection is available. And we do have an amazing group of vaccines for COVID-19. We have vaccines for influenza. Get those vaccines. The upside is so much greater than the modest risks that, again, Dr. Tucker outlined well, that there's no reason that we should fail to protect ourselves with those vaccines. But in addition, we have to use common sense and think about the fact that these are respiratory viruses. And so when we are in crowded and closed indoor spaces, where our risk of acquiring those viruses is really elevated. And those are times where we need to rethink, do I need to be in that space? If I am in that space, does it make sense for me to be wearing a mask, et cetera? Let me turn to my two colleagues. Anything that you'd add about the winter and the risk of the winter viruses?
I think specifically for adult patients, which is my area of expertise, those folks that are the highest risk really need to strongly consider what winter and all of the gatherings that come with it represent. I agree with you, Dr. Vanderhoff. This is a great opportunity to really strongly consider protecting yourself to your maximal ability, which is, Pfizer is now FDA approved. It's been given to more Americans than any of the other vaccines. It's readily accessible. It's been demonstrated to be very safe and highly effective at protecting your life. For those folks out there that are at least at the greatest risk, if you're still very hesitant, this is the time to protect yourself against a high transmission period.
And I would just say from a pediatric perspective, I would echo the concerns because it is so unpredictable as to what kind of flu season we'll see. The concern is that if on top of the huge volumes we're seeing now, we add that to the mix, that it will further stress our system. So whenever possible, it seems the best protection would be to go ahead and make sure if you're eligible, get a COVID vaccine and then get your flu vaccine. And that way you give yourself the best chance and your family the best chance.
Your next question, which is the last question for today, is from Andy Chow with Ohio Public Radio.
Hi, Andy.
Hey, Dr. Vanderhoff. I wanted to get your take on the announcement from House Republicans yesterday, who said that they want to move on from considering these potential bans on COVID-19 vaccine mandates. I'm wondering, what do you think about that? And do you think that opens the door for the Ohio Department of Health to maybe move forward with new policy regarding the COVID-19 vaccine?
Well, I'll tell you, we have been encouraged, really encouraged by the increase in vaccination numbers that we've seen across the state just in the course of the last couple of months. As I shared or alluded to in my earlier comments, among people who are eligible to receive the vaccine, we've now moved up above that 60% threshold. So we're doing very, very well in that continuing journey. As it relates to the issue of who needs to have the vaccine in order to perform their role or their occupation, et cetera, the Department of Health has really stayed out of that. What we have aimed to do is provide good information. We aim to encourage people to take advantage of this amazing opportunity that's available to them to protect themselves against a very dangerous virus. But we've really left it to organizations, businesses to examine the issue of how COVID-19 impacts them, their business, their workforce, and to address those issues at that level. So, our focus remains on getting good information out to people and encouraging vaccination rather than as a Department of Health providing specific mandates for the vaccine.
Okay, thank you very much, everyone. That concludes our press conference. Dr. Vanderhoff, do you have any closing remarks?
Just want to thank everyone again. I do want to underline and remind everyone of the importance of vaccination as we head into the holiday season. It's the best way to assure that you're well protected, especially from the risk of getting severely ill, ending up, God forbid, as one of our hospitalized or mortality statistics. This is just not the time of year to have that kind of tragedy visit your family. And so I'm pleading again with everyone who has yet to be vaccinated, talk to your doctor, talk to your health professional about whether this might be the opportune time for you to take advantage of these vaccines and protect yourself for the winter holidays. Thank you.